Having serious mental health needs for a long time can be really difficult for people, their families and friends. We want to do the best for every person we care for. People accessing services, their carers and families think it would be better to care for people in their homes and nearer to where they live instead of hospital, and that those who do need to go to hospital get the best possible care to meet their needs. This animation explains why we need to improve these services for the 7,000 people who access them in Eastern Cheshire, South Cheshire and Vale Royal, and how we want to make them better. There are teams who can care for people with mental health needs in their home or nearer to where they live instead of in a hospital. Most people are cared for this way. There are also 3 places in Cheshire where people with serious mental health needs can stay when they need treatment. The money available for mental health services is staying the same, but we want to be sure we spend it in the best way to help as many people as possible. There are also rules about doing things well and safely. We will have to make some changes to make sure we follow the rules. The Millbrook unit does not meet the requirements of modern mental health services due to the absence of single ensuite rooms and appropriate seclusion areas, nor does it have a psychiatric intensive care unit. We know more people will need mental health and dementia services in the future, and we know that people want to stay closer to home for as long as possible instead of going to hospital. We want more staff and bigger teams to care for people in their own homes or nearer to where they live instead of in hospitals. We want to create a new service to help people in an emergency at any time of the day or night. We want to keep them out of hospital if we can. We want to open new cafes and drop-in centres where people will be able to get help and support. We also want to help people with dementia in their own home instead of going to hospital. We've worked with people who use our services, their families, friends and carers, and the people who work in these services to find ways we can make them better for you. We've made a list of 3 options, and we want you to tell us what you think about these ideas. Option 1 is to not introduce the proposed new model of care. There would be no new team to help people in an emergency. There would be no new services to help people with dementia in their own homes. A lot more money would have to be spent to make the Millbrook unit meet modern mental health standards so it could stay open. This money, £14 million, would have to come from other NHS services. People will still go to hospital for mental health care when they could have been seen closer to home. Option 2 is to have bigger teams to help people in their own home and nearer to where they live instead of in hospital. The Millbrook unit would be replaced with a range of new services, including a new ward opening at Beaumere Hospital in Chester for adults needing lots of help. The changes would mean that approximately 260 adults would have to travel further than they do now. However, for some, it would be closer. Patients already get help with transport from the NHS, and we would also provide support for carers to visit. In addition, older people who need to stay in hospital would be cared for in a new centre based at Limewalk House in Macclesfield. In addition, we would create a new team to help people in an emergency, provide cafes and drop-in centres, and create a new service to help people with dementia and those who need therapy. 6 new beds would be open all day and all night for people to stay in a crisis. They would allow people to stay nearer to where they live instead of in hospitals. Option 3 is the same as option 2, but in this option, all older people who need to stay in hospital would go to Beaumere Hospital in Chester. The changes would mean approximately 70 older people would have to travel further than they do now. However, for some it would be closer. Patients already get help with transport from the NHS, and we would also provide support for carers to visit. Adults who need to stay in hospital would be cared for in a new centre based at Limewalk House in Macclesfield. We would create the same new teams and services as in option 2. The cost of the changes for option 2 or 3 would be a lot less than the cost of keeping the Millbrook unit open. We have enough money to pay for option 2 or 3, but would have to take over £14 million from other local healthcare services to fund option 1. We think option 2 is the best choice because we think it is the best way to give patients, their families, friends and carers the support they've asked for. We want to hear from people, their families, friends and carers who use our mental health services in Eastern Cheshire, South Cheshire and Vale Royal. We want you to tell us what you think about these ideas, and we'll be asking people what they think between the 6th of March to the 29th of May.